Hello and welcome to COVID Conversations here on WNCU 90.7 FM. I'm Kimberly Pierce Cartwright, your host. We're using the Zoom platform to talk about how the COVID-19 pandemic is affecting our world. COVID-19 and the recession are putting enormous pressures on homelessness and service systems. They are responding in various promising ways, reaching people living in poverty. There's a list of challenges that they need to overcome. Many are related to the availability of resources. My guest today is on the front lines helping people in need at the Durham Rescue Mission. Welcome to Robert Tart. He is the Chief Operating Officer of the Durham Rescue Mission. Hello, how are you?
I'm doing very well. How are you today?
I'm doing so well. And I'd like you to start off by talking about the Durham Rescue Mission and its mission and purpose.
Yeah, well, the Durham Rescue Mission was founded in 1974 by Ernie and Gail Mills. They're still with us. They work about every day. Yeah, they work every day. They just take different days off than the rest of us, if you know what I'm saying. And but the point is that they started it. It was a homeless facility from the beginning. It still is a homeless facility, but we do so much more than a homeless. And then just providing beds and things to eat. We provide a full range of services that are designed to help meet the holistic needs of a homeless person, men, women, and children.
And that's a little bit different from the mission that it started with. It started very humbly from the history that I have read about, a very small mission, and it has grown into what it is today. Can you talk about like the programs that are offered at the mission for people in need? What are some of the things that you provide people?
Well, so much of the homeless community is probably 75% of the men that come into the facility here admit to some kind of an addiction, a debilitating addiction. That number is lower for the ladies, but still, nonetheless, it's still a big number. So one of the big things, the biggest thing that we try to address is addiction. And so we have what we call our Victory program for both our men and women's program. And that is our spiritual program that we've designed trying to address the issue of addiction, hopefully being able to help these people to get to the point where they can self-sustain themselves.
Okay, what other services are there?
Well, we offer a lot. We have
just a list of some of the other things that you do.
Sure, we have a vocational training, we have educational training, we have an employment agency where we try to place people into gainful employment, and then we work very closely with Samaritan Health Center that actually started out of here. It originally was just doctors helping us here, so we try to provide some health services and then all the other surrounding things around those things.
Mm-hmm. So I want to talk about the number of people. So before the pandemic, there was a number of people coming, and now during the pandemic, so how have the numbers grown or decreased? So what is it looking like now as far as being able to provide service to the people?
Well, for us, it's been a roller coaster. For a while there, when it first started hitting, we swelled tremendously. And we got a little nervous because I think what happened that the shelter downtown started limiting how many people they were going to take in. And if you remember, I don't know if you remember, the city was putting people in the hotels, I think Marriott or somewhere like that. Well, we really just started busting at the seams. It looked like a snow event here in the middle of the winter because we just had so many, and we got nervous because we were just getting so tight, and we were supposed to be social distancing. So we actually stopped taking in people for a while there, just as a precaution. And we've actually had to stop another time or two taking in people because we did have some people with COVID here. And so I think because of that, people are getting a little bit afraid of coming into a congregate setting. So our numbers are actually down right now, but I think it's because people are just choosing to stay out in the weather, out in the streets, rather than to come into a congregate setting.
That's devastating. That is so sad. So when people do choose to stay out on the street, is their service also extended to them?
Well, the rescue mission doesn't have the means to do that. I do know that we've been talking with the city and emergency management. They're trying to provide housing for people right now in the cold weather. They're providing blankets and things like that. But also, I think that they're working with Carolina Duke Inn. I don't remember how many rooms that they're procuring each night, but they're also trying to work with another facility where we can open up just an overnight shelter to get people in out of the bad weather through this cold time. But that hasn't come together yet. We're still working on that.
So I want you to talk to me now about like the flow of people. So you said at the beginning you were like burgeoning at the seams and had to turn away people. So how is it that you manage when people come in and manage them through the procedures that you need to as they are related to COVID-19?
Well, this has been a learning process for us, as it has been for everyone. What we're doing now, and we have been for a little bit now, is that when people come in, they immediately go into a 7-day quarantine. And we have Duke coming out regularly, and they're testing. Sometimes they're testing everybody. Sometimes they're just testing people that we for whatever reason deem they need to be tested. They've shown some symptoms or whatever. But everybody that's a new client is tested within that first 7 days just to see where they are, and so we get a baseline. But we're doing a lot more testing. Duke has been great. The county the health department has been very helpful as well. And we're just doing a lot more testing. And we do a lot of cleaning. We've got people running around regularly with these spraying machines that just mist everywhere, and everybody's wearing masks, and we're doing all we can. And but it's still, there's a lot of bullets with this COVID flying around right now, if you know what I'm saying. There's a lot of people. It's increasing in its spread, and we're not able to dodge all those bullets either.
So how do people find you? Where do they come for intake? What's the first step?
Well, they would just come up to what we call our welcome center at the driveway. Most of it is just word of mouth. And we do advertise a little bit out there, and we put ourselves out on the internet and online and Facebook and places like that, making ourselves known. But a lot of it is just word of mouth, where the homeless community, they have a network, if you will. I don't think it's a formal network, but they still somehow communicate with one another, and they learn about us. We do get a lot of people that learn about us through the social services program. They'll go down there looking for something, and if they don't have anything for them, they might refer them to us. We get a lot of people that come out of the prison system, that the prisons just bring them here and just drop them off. Sometimes hospitals will, like Duke and Regional, and even some hospitals in Raleigh, sometimes we even send people over here because they just have nowhere to put them and nowhere to send them. And so they send them to us. So it comes from a variety of means.
So can you walk me through maybe like a day in the life of, and maybe some of the strategic planning that you do to get through a day with the COVID pandemic, like biting at your heels, to help people who are homeless and in need of service?
Well, we've really cut back on our actual programs and services right now, just because we don't want to get together that much. We've tried to do some here and tried to do some there. There are some things we just have to do. That we have to sit down and counsel with people occasionally because they just have to have it. I mean, I don't know another way to describe it. I mean, you can get sick with COVID, or you can suffer through some trauma. And so we still are meeting with the people individually, but we're not doing our group meetings at all right now, and which is not helping anything. And so in that respect, we're doing a lot less than we were. But at the same time, we're trying to, like I said, try to meet with people individually and talk to them individually and try to deal with them. And one of the big things that's hurting the rescue mission right now is the fact that we live a lot on our finances. We don't take any government money, and all of our finances come from donors or through our thrift stores, which are in-kind donations. Well, because of all the reducing numbers, and because if someone gets COVID, then there might be 20 people that have been in contact with that person. They've got to go into quarantine. We just don't have the labor we did. We just don't have the people to the stores. We've had to close them, and sometimes we'll close one because we just don't have enough people to run it, and then we'll open it back up or whatever. But we're doing our best to keep those things going so that we can keep our funding up. But this has been a rough year in every respect on the rescue mission. We're not able to provide the services we would normally do. You know, the finances have been strained because of everybody's finances have been strained at this time. And just providing the basic services like food. I mean, that's probably the biggest thing is feeding people, because generally our dining room is where everybody would go and eat. Well, we can't put everybody in there at one time now, like we used to. We used to put, 150 people in there pretty easy. And, but you can't do that now. So we have to spread out the times that people eat, and they just have to be a more lighter shifts, if you know what I'm saying. And normally our tables are like 8-foot tables. We would put, 4 or 6 people around the table very comfortably. Now we only allow 2 per table. That gets them, they're 8-foot tables, so they're 8 feet apart. And just things like that. We're trying to keep everybody clean and safe and sanitized, and it's been a chore.
Can we talk a little bit more about like PPE? How are you managing to make sure that people have the protection that they need, employees and people who come to you for service?
Right. Well, the biggest thing we're doing is constantly spraying and wiping down. We got people, I don't know how many people, we got 4 or 5 people around the whole mission, different places, that are just constantly wiping down or spraying or sanitizing the areas. Of course, we've got everybody with face masks. We're trying to give gloves to people that need them. We're not walking around in robes and oxygen masks and things like you see the testers. When they come, they look like they're ready to go on the moon or something. But we're not able to do anything like that. But we're doing our best to keep everybody separate with a mask and sanitize with sanitizers and things like that.
So what's your biggest challenge during the day? The biggest thing that you come in and that's the thing that you get down to when you start to work?
Well, like I said, feeding everybody is probably the biggest challenge. Probably the hardest thing. I mean, I always tell people that when it comes to homelessness, the problem really isn't a lack of homes. There's homes everywhere, and we need more homes. I realize we have a homeless, but that's not what causes the average person to come to the rescue mission. The biggest problem that people have, in my opinion, this is my opinion, the biggest problem people have that causes their homelessness is a lack of, I don't know the right word, solid, good relationships. A lot of people go through financial problems. A lot of people go through health problems, different problems. We all go through problems. But those people that have family and social networks that help catch them, prevent them from going down in that hole of homelessness. But the people that come to the rescue mission, so often they don't have anybody. Those relationships are gone. And they often find relationships here at the rescue mission. They find friends and counselors and people that can help them. Well, that right there is the biggest problem that COVID is creating, that we can't meet those needs that they so desperately need. We hear so much about, we're separated at Christmas, we're separated at Thanksgiving. Well, for the homeless person, that's a regular occurrence. That's not just a holidays. And I was just talking to one of our staff members today, said, man, we got to do something at Christmas because, suicide rates go up at Christmas. And this is a very sad place sometimes around Christmas. There's a lot of people, the family will connect with them at Christmas. Somebody will connect with them at Christmas. There's a lot of people hanging around this rescue mission all day Christmas Day. And I hate to say it, it's a miserable time for them. And we got to come up with a way to meet that need. That is probably I don't know, it's not material, but it is clearly the biggest problem. The biggest material problem is just getting people fed.
Yes. Okay, we're running low on time. So if there's anybody who's interested in being in touch with the Durham Rescue Mission, how can they do that?
I would suggest they go to our website, durhamrescuemission.org or rescuemissionministries.org, either one will work. And they can find volunteer information, they can find program information, they can find anything that they need, or if only a phone number, they can find a phone number that they can call and connect with one of us.
Okay. Robert Tart, you are the Chief Operating Officer of the Durham Rescue Mission, and the service that you provide the homeless is very much appreciated. Tell Ernie Mills and Sister Mills that I said hello.
I will. Thank you for this opportunity.
You're very welcome. And thank you, audience, for listening, and thank you for watching COVID Conversations by way of WNCU here on Zoom. I'm Kimberly Pierce Cartwright, your host. Until next time.